discussion. How many minutes do we have? We are going to target to each speaker. Okay, we're going to do it slightly differently from last time, because we found last time when we did an open session that all the questions were targeted to one speaker. In fact, that happened in this morning session also. Here, we will allow 5 minutes per speaker, right? And so, whoever wants to ask a question, please don't make a speech. You can make a brief comment if you want. Identify yourself and target the question specifically to one speaker. So, shall we start in the reverse order? Okay, we'll start in the reverse order. So, it's Kusal's turn now. Okay. Atula, we can't hear you. I think you need a slot. Yeah.
I'm Professor Atula Sumatipala, Professor Psychiatry at University of Keele, and I'm also the Honorary Director at Research Institute in Sri Lanka. It's a comment, Kusal. Thank you very much for your, it's a motivational lecture. Knowledge-seeking lectures can be given, and, even you can read up. I really just want to thank, and you actually tagged in everybody's thing, and you actually sealed everything in. I just want to, it's excellent lecture, and it's very valuable because we need to do motivational lectures, and coming from being a behavioral scientist, I just want to say you're doing exactly what I'm doing. So we have identified, at Keele we have a center of excellence for pain research, where I'm the research, so I'll talk to you later. Thanks.
Maybe we can lecture together somewhere.
Why not?
Yeah, that'll be good.
I'm a frequent visitor to Sri Lanka as well.
Wonderful, great. Maybe we'll talk later. Thank you.
Okay. Any more questions to Kusal? Tell me when the 5 minutes are. Okay. Any more questions to Kusal? Right? Yeah.
Hello, Kusal. Thank you very much for your presentation. I'm Pat Black from Keele University. I was interested in one of your last slides, which said you should forget the past and it just be a memory. In my profession, we are very much into reflective practice and reflective learning. So how does forgetting the past relate to that, perhaps?
Very good. Thank you for your
and
question.
Learning from the past.
I think learning, although I say forget the past, I'm very big on learning from the mistakes in the past. As a sports physio, we only ever have a small idea of what happens in the psychology of a person. It's not my area of expertise. So I tend to push people to always work out how we can get themselves into the present moment. So I guess I'm being very harsh in saying forget the past. I'm saying pretty much there's so much happening in the present moment. Let's just change that focus. So no, I wouldn't ever say forget the. I did, didn't I? I did say forget the past. Maybe we can. Maybe I'll redo it. We'll re-edit the video, and I'll say we'll learn from the past.
So you agree? You can learn from.
We'll learn.
You can learn from the good things and the bad things.
Definitely.
For the present.
All right. That's right. Is that okay?
Yeah.
Brilliant.
Oh, wonderful. Thank you.
Any more questions? Comments? Well, I have one comment. I mean, you are harping on quick results or instant results. Maybe in the discipline of sports and pain relief, that may be there. But should that be the goal for all professionals? Because there are some professions where you can't go for quick results.
Even with everything we do, we set ourselves a benchmark that we want to make a difference in that person's life or in their condition in 3 sessions or less. Now, in some conditions, it's very difficult to make a difference, even in 3. But what people will respond to is whether you have a plan or not. So if you have a concrete plan in place, it's very reassuring for people. And I'm a very big believer in letting people know that, okay, it's 3 sessions or less, that's the grand plan, but if that doesn't work, we have this template to follow step by step to help you out.
Okay.
And that alleviates the fear.
Thank you. I think I get your point. How many minutes more? We have another minute for a question to Kuzari. Question or a comment, a prefer a question actually. No? What about the students? What men? You all are very silent. Huh? Surely you, I mean, you should.
Who came to my workshop yesterday? That's why, no one. None of the students are here.
Okay, I think we will move over to Mr. Vimalasena, right, the session on radiography. Come on, please. See, I'm supposed to do some final comments, but I might as well use he made a very big point. I think he made the point that these disciplines should have been graduate disciplines a long time ago in Sri Lanka. I fully accept that point. I have been an academic in a medical school for a long time, and I have been in a tiny minority taking that position, and it took a long, long time before people considered that these disciplines are graduate level disciplines, that they have a knowledge base which needs to be done at graduate level. So now it has been considered only very recently, and most of the courses are almost like in their embryonic phases. So because of that, we have the practitioners we have not had a graduate background very often. Right? I'm very happy to see that Mr. Vimalasena, after having done radiography, has done a degree in electrical engineering. But it's rare. Most of the time we have mainly practitioners, but who are absolutely solid in what they do, and they can teach what they practice. So in our disciplines now, when we teach, we have to make use of practitioners who may not have a degree even, right, in order to develop our courses. And of course, we are glad when we can cooperate with institutions like yours, which have already been doing it. So this is the context in which we are doing. So we are really glad to have Mr. Vimalasena come and talk to us today, being a real practitioner and a head of a school which trains actual practitioners in the ministry. I mean, they have done a great job in the Ministry of Health. They have trained all the health institutes. So please ask him some questions, or right. Now, you see about the
Thank you, sir. Thank you very much for your presentation. You mentioned that evidence-based practice also should apply to radiography. So I think this is the time we can implement this evidence-based practice to radiography also. Thank you very much.
Not only in radiography, the evidence-based practice has to be applied in every field. In fact, physiotherapy, medical laboratory technology, even nursing and pharmacy, it has to be there. Now, of course, the evidence-based practice in medicine has been low there for a long time, but now it is started. It is still mainly in the developed countries. The evidence-based practice in radiography is being done in countries like Australia, Canada, and England. They do.
Have you found much resistance in your profession to the implementation of evidence-based practice? Because sometimes well-established practitioners who've done things in a certain way for a long time and hadn't had any adverse effects or haven't noticed any detriment to the patient and don't want to change might not be very conducive to engaging with it or doing the background reading that's necessary to engage with it. I just wondered how that was in radiography.
Of course, yes. Yeah, there is some resistance, of course. Still, although we say we are professionals, I think in our country, still, some people, they don't like to accept us, we are professionals. That problem is there.
I just want to thank Dr. Mr. Vimalasena for that very informative presentation. As a Dean of Allied Health Sciences faculty, I'm very happy to say we have already taken initiatives to introduce this evidence-based practice to our 5 BSc programs. So thank you.
Is he one of our listening lecturers?
Yes, he is, and also Dr. Gominda Ponnamperama has come and given a lecture on that. That's to initiate this evidence-based practice. So I'm very happy to say that we have taken the initiative to introduce this evidence-based practice to 5 BSc programs.
What about our students can get practical training in the setup?
Of course, yeah. We
will be welcoming them?
Yes, we are providing.
That's very good.
Yeah, at the moment we provide the practical training. Yes.
All right. So the time is up for Mr. Vimalasena, but I will... Right, okay. Now we can direct our questions to Professor Stephen. The avatars, they were... right. See, he concentrated only one small aspect of his expertise. He had a wide repertoire, but he spent most of the time on his pet area, which is virtual. This thing, please ask, what do you feel? What do you feel about that technique and the avatars? And would you like to interact with avatars? Yeah, sure, of course.
Stephen, how much is that program? Is it available to be bought?
That's his business acumen working now.
Well, the thing is, we see so much potential there in teaching and in the lecturing side, and if that's available and we can do it remotely, and so many programs that can be done even from the sports physio angle. I see a lot of potential there, and I feel that's where the next 5 to 10 years in education is headed. Have you guys? Is it for sale? Is it for lease? Is it?
Oh, I can use this. Marvellous. Yes, it is for sale. Yes, it is for lease. The cost is not as prohibitive as you might think. If you want to use the avatars can be delivered online via a PC, an iPhone, an iPad. To do them from scratch takes about 12 weeks and probably about £25,000 sterling. But if you wanted to license what we've already got, then the costs are relatively modest. You're talking about a couple of £1,000 or something like that. A couple of thousand. Okay. For the cave itself, which is the really whizzy big piece of technology, again, you can adjust the costs according to your need. So if you wanted a whole cube singing, dancing, you could probably get that now for around about £120,000 sterling. Now, that might sound expensive, but if you think of the cost of the alternative, the number of placement, the amount of placement activity you can put into a cave, and the fact that a lot of it is asynchronous. In other words, you don't need a tutor at the other end for it to work. The same applies to the online avatars. You can take an avatar and you can work with it 20, 50, 100 times until you're happy. And it's still useful because you're getting feedback all the time on what you do. So a cave you could probably build now, technology is coming down in price all the time, for around about £120,000. You could have a one-wall cave, so not the whole thing, for less than that, probably £50,000 to £60,000.
I wish our Vice Chancellor was here. Right. Any more questions? Yeah. We have 2 minutes more. So, I would like to, it's Govinda talked about multi-professional, but you are using, especially in the cave, a multi-professional approach. So, how successful is that in the sense, how do they really interact with each other?
I'll answer that in 2 parts, if I may. As I said, the photographs I took were from a pilot we did last year, and we're just in the process of writing that pilot up. The qualitative study showed it to be extremely successful. When we evaluated it in 2 ways. We looked at knowledge before and knowledge afterwards. And then we also got a series of interviews with each of the healthcare professionals separately and a focus group of the healthcare professionals together. And what was really interesting was the comments that came when we interviewed the healthcare professional students individually were almost identical, which is, I hadn't realised before what part I had in the team or what the other people did in the team. And the other thing was, there was nothing like getting the adrenaline rush of reality to make them realise how it was going to be in the real world. So from that point of view, I'd say it was successful. Now, it's not utopia. You know, like any other project, there are limitations. One is space, which, as you can see, it's a finite space, so you can only deal with about, in 1 3-hour session, probably 25 students. We have a potential solution to that. A colleague of mine, Jonathan Berry, is doing a PhD with me, and we're doing interprofessional education using avatars over the internet. So the idea will be, and this will be happening next year, for a whole student cohort of pharmacy students, medical student, nursing students, we're going to take a week in the course, and we're going to say, during this week, you're on call. You can go about your normal daily business, etc. We'll make a little bit of accommodation in the timetable, but at some point, your phone will ring, and you're going to have to manage a patient. And from that point onwards, they manage the patient using their mobile phone, and then either going onto a PC or just using a smartphone to look after an avatar that's in a hospital bed, and then discharge it into the community. Now, the reason I mention that is that's quite a radical departure. Most simulations deal with acute situations, heart attacks or stuff like that. What we want to do is simulate the most common things, which are long-term conditions. So our first simulation will be a little old lady with rheumatoid arthritis who's in hospital, being worked up, got pain relief, needs to be discharged, have a medicines review on discharge, go out into the community, have her medicines transferred successfully, connect up with social services, connect up with community pharmacy, connect up with the general practitioner. And they'll be able to simulate that all remotely using their phones. So,
Okay, now to Dr. Gominder. 5 minutes. Come on. Yes. Yes, go ahead.
Thank you. I really enjoyed your presentation, Gominda. One thing that we have got challenges with is when we're trying to set up a new service where health professionals who maybe have never worked together are being asked to work together. And I'll give you an example of pharmacists perhaps and medical practitioners. And what was the key thing about initiating that sort of education around communication and teamwork? What's the key thing to start with?
But if you think of a stepwise way of introducing, because asking them to practice in a team may be a little bit more intimidating. Is that what you say? In that case, probably, I think it will not happen if they have been trained in the same way throughout their training, but that has not happened in the past. So probably, I think it's a gradual process of understanding each other. I mean, in that sense, the 3 models that I said, which are in a way a hierarchical set of models, may be a good way of doing it. First, ask them to eat together, drink together, and before practicing together.
Yeah. Sometimes it's trying to break down the sort of hierarchies that might exist and having a drink together or just a meal or sitting down and understanding what each other do. Yeah.
Exactly. Can't agree with you more.
Yes, Abdullah.
Thanks, Gominda. The speaker spoke about the need for continuous professional development. And knowledge learning never finishes. I saw my 3 colleagues from Kiel taking notes down, which is a compliment to Gominda. Always listening to your lectures, there's a lot to learn from. And I just want to make one advertisement which wasn't mentioned in your introduction. Gominda is actually one of the founder members of Institute for Research and Development. He is a council member as well, so which we have put, establish a state-of-the-art research institution which has international impact. Thanks, Gominda, for that I apologize for advertising, but I think you should take the credit for that as well. And I was more impressed about them taking the notes.
Thank you very much. Sorry, I may have not advertised IRD in my CV. Sorry for that, but I was limited for 100 words, so I had to economize.
I'm also having a question from Dr. Gomind. Actually, it's a very really interesting topic, the communication, teamwork, and leadership for this multi-professional healthcare settings. So, are there any sort of real training scenarios? For example, the on-the-job training scenarios for this, you talked on interprofessional education. So, in the Sri Lankan context, hospital setting, are there any sort of real scenarios you are applying this technique?
I think yes and no. I think now they are coming up with some type of activity like that, but it's nothing organized and nothing sort of sustainable. But I see the odd one where nurses and, I mean, my colleague on the other side, in the other room, Dr. Dujipa Samarasekara has a program which is an educational program for, I think, your lecturers also come there.
Actually, one of his colleagues, the nursing lecturer,
correct,
in Colombo gave
correct,
especially
that's part of
how they work together.
Yeah, that's.
I will make a comment at the end about this.
That's part of that. That what President Narada was telling is part of that big program. They are, as teachers, health professional teachers, nursing, medical, physiotherapy, all professions learn together. I think that is I would say that's a start. And also I see some workshops on and off, but nothing sustainable, nothing concrete, and nothing, it's still picking up. It's still picking up, but that's Sri Lanka. But if you go on the web, there are a lot of sources and a lot of resources.
Okay, thanks.
Time up. Time up. I think I had to conclude. I must say it has been a really wonderful session, and we must really appreciate the 4 speakers. They had different styles and different content, but I think it all gelled together, really conveyed a message to us. I must say I'm really happy to be chairing this session. Regarding multi-professional education, I can say I'm married to a nurse, and I think the first time I fell in love with her was when she was assisting me in doing a cut down for a baby who was severely dehydrated. Those days we didn't have this sophisticated cannulae, and we had to do what's called a saphenous cut down, where you cut and expose the saphenous and you have to get a tiny cannula in. Now I could do the cutting and exposing the saphenous, but I could never get the cannula in. And it was Ira who always got the cannula right into the thing. So I think that was the time probably it clicked, right, this thing. But what I mean is, we are so used to working with each other together. Now, I'm really surprised that this multi-professional approach to training has not taken place before in a formal way. I think there are tremendous opportunities, especially now like us. We have a medical faculty side by side with a faculty of allied health sciences. I can say I have been a clinical teacher for nearly 40 years, and I have been practicing multi-professional teaching, because whenever I do a teaching round, it's primarily meant for medical students. Sometimes I have a couple of postgraduates tagging on with me, but if there are any nursing students on the ward, I invite them to join the round. And at each patient, I will ask the right question from the postgraduate, the right one from the medical student, and the right one from and I make them talk to each other, because there are things. So I have been practicing it in my clinical teaching for the last 20 to 30 years. And I'm not the only one. There are several clinicians who are doing this. So it is there in an informal way. But we can do it in a formal way. And what I was telling Gominda, we saw a brilliant presentation. Singapore really pays for their education. And they've set up a complete center for mimicking, what do they call it? Not for interprofessional, where you use all the videos, the skills, complete skills building for skills training, and which is accessible to all students. And they were showing, now for example, if you are doing a skills training on a crash, cardiac arrest, resuscitation. Absurd doing it for doctors, because you don't manage it. Doctors alone don't manage cardiac arrest. Doctors and the nurses and everybody. So the training can also be, even in the skills lab or in the real life, together. I mean, we should have been doing it a long time ago. Even in the British universities, it's still not, very established. I really don't know why, but I think we now have the potential to start doing it. And we should look at all experiences of doing it. And I'm sure that, already there is informal social contact, proving from my experience, but that social contact that we have could be made into mutually beneficial professional contact right from the beginning. And then it breeds respect for each other, because you come to know what each other is doing. Unfortunately, in our country at the present moment, there is a little bit of protectionism on the part of each profession, and sometimes we see really ugly TV shows where two professions and trade union leaders come and insult each other. Right? I mean, as a medical teacher who have taught all these categories, I virtually cry when I see them. Right? So I think that should not be the case, and we could really work together, and we can learn together. And I think the potential is there, and I think this room is full of people who can contribute to that, both as learners and teachers. Thank you very much again. We have had a good session.
Thank you very much, sir. I would like to invite Professor Tilak Veerasooriya, Deputy Vice Chancellor Academic, to present the certificates and tokens of appreciation to the distinguished plenary speakers today. Professor Tilak Veerasooriya will be accompanied by Colonel P.T.R. Makuloluwa, Dean, Faculty of Allied Health Sciences. Dr. Gominda Ponnamperuma for his plenary speech on training in communication, teamwork and leadership in multi-professional healthcare setting. Professor Stephen Chapman for his plenary speech on creating a culture of evidence-based clinical practice. Mr. V.G. Vimalasena for his plenary speech on professional approach to radiation protection. Mr. Kusal Gunawardena for his plenary speech on how real professionalism can change a nation and the sports activity too. Next token of appreciation is presented to Professor Narada Varnasooriya, who was the chairperson of the session today. Sir, your contribution towards the success of our plenary session is invaluable. Thank you very much. Thank you very much, sir. Thank you very much, madam. Before we conclude, I would like to thank all four distinguished plenary speakers, session chair, all the invitees and the participants, rapporteur, and all the other academic, non-academic, and military staff members who helped us to make this event a success. With that thanking note, we conclude the plenary session of Faculty of Allied Health Sciences for 8th International Research Conference of General Sir John Kathalawala Defence University. Thank you very much.